Effective flu treatment methods at home that everyone should know. Proper treatment can help reduce unpleasant symptoms quickly, and patients can recover faster. Here are some effective ways to treat flu at home. 1. Use flu medicine. Use flu medicine in cases where the patient wants to quickly reduce flu symptoms or when the condition worsens when treating flu at home. Patients should be prescribed medication by doctors before using any medication. 2. Let the body rest. During the process of treating flu at home, take time to rest and relax so that the condition can progress better. Don't stay up too late. Get enough sleep. A reasonable sleep cycle is the key to a better immune system. Get 8 hours of sleep every night, both when sick and when healthy. 3. Increase humidity in the surrounding environment. Influenza viruses survive longer in dry air. This makes the virus spread faster and easier. Especially in the cold season, the air in the house can be dry due to the use of heating or air conditioning. Using a humidifier to increase humidity in the house and workplace, helping to reduce influenza viruses in the air is an effective way to treat influenza at home. In addition, humid air also helps patients reduce symptoms of nasal congestion and sore throat. 4. Steam to treat influenza at home. If you want to clear your airways, you can boil a pot of boiling water to steam your nose. Boil water, use a towel to cover your head, close your eyes, and lean forward to let the steam rise to your face. Sit still and breathe deeply for 30 seconds. You can apply the leaf steaming method to increase the effectiveness with the following ingredients: lemongrass leaves, mint leaves, each 10, 20 guillards or a large handful. Except for mint leaves, wash the lemongrass leaves and put them in a pot of water, boil for about 10 minutes. When preparing to steam, add mint and continue to boil for 1 to 2 minutes. 5. Treat flu by bathing in warm water. Bathing in warm water helps to add steam, keep moist, and clear the nose, making breathing easier.
Do not bathe in cold water, which will cause the body temperature to suddenly drop, making the condition worse. Note: do not bathe if the body temperature is unstable or dizzy. If you feel cold, increase the water temperature. 6. Use a heat pack. Apply a warm towel to the forehead and nose to help reduce headaches and sinus pain. This effectively supports treating flu at home. 7. Gargle and clean the nose with salt water. Diluted salt water has a high antibacterial and antiseptic effect. Gargling with salt water when having flu also helps to remove mucus accumulated in the back of the throat, especially when performing the movement of tilting the neck to gargle. Persistently gargling salt water for many consecutive days helps to quickly reduce symptoms of sore throat, and throat infection. 8. Elevate your head when sleeping. Flu patients may experience nasal congestion, especially at night. Elevating your head when sleeping helps the nose to drain mucus and also prevents frequent heartburn.
To thin the mucus in the nose, patients can humidify the bedroom with a humidifier. 9. Apply essential oils. Some essential oils can help you fight certain viruses and bacteria, contributing to effective home remedies for flu. Tea tree oil can help you fight the flu virus by slowing or stopping the rate of virus replication. It is most effective when used within the first 2 hours after infection. Other essential oils from plants and herbs can act as natural antibiotics and antivirals, such as cinnamon oil, peppermint oil, eucalyptus oil, geranium oil, lemon oil, thyme oil, oregano oil. Diffusing essential oils into the air can help fight certain viruses and bacteria. Note that aromatherapy can affect children, pregnant women, and pets. 10. Drink plenty of water to cure the flu fastest. The flu can cause dehydration if accompanied by symptoms of vomiting and diarrhea. Make sure to provide enough water for the body with filtered water, fruit juice, or electrolyte-supplemented drinks. 11. Eat liquid and warm foods. People with the flu may have a fever, cough, headache, sore throat, and general fatigue, You should eat foods that are easy to digest and warm, such as meat soup, porridge, or chicken soup. 12. Add foods rich in zinc. Zinc can shorten the duration of flu or colds. Some foods rich in zinc include meats, typically beef, lamb, pork, etc. A 100-gram serving of raw ground beef contains 4.8 milligallons of zinc, accounting for 44% of the daily value. Nuts contain a lot of zinc, fiber, healthy fats, vitamins, and minerals. Nuts include pumpkin seeds, sesame seeds, flax seeds, peanuts, cashews, almonds, etc. Eggs contain a moderate amount of zinc to help you achieve your daily goals. Not only zinc, eggs also contain many vitamins and minerals such as vitamin B, selenium, choline, etc. 13. Eat rich foods. Divide meals into small portions. Eye-catching dishes with rich flavors will awaken the appetite of flu patients. Will help flu patients feel more delicious. Flu patients should divide their daily meals into 4 to 5 small meals. Dividing meals in proportion to the amount of food in each meal will help the digestive system work more easily and quickly. Flu patients also need to avoid the following foods. Fast food contains a lot of fat, causing chills and loss of appetite. Fruits containing a lot of fructose, plums, raisins, dates, cherries, etc., causing bloating and indigestion. Beans contain a lot of protein and sugar. Eating a lot causes bloating. Carbonated drinks can cause a false fullness phenomenon, making the patient no longer want to eat other foods. 14. Avoid using stimulants such as cigarettes, beer, alcohol. Specifically, alcohol in beer and wine can cause dehydration, which makes symptoms of stuffy nose and sore throat worse. When you have a cold, your body's immune system has weakened. Drinking alcoholic beverages such as beer and wine makes it harder for the patient's body to recover than usual. On the other hand, people with flu should not drink alcohol or beer because of their interactions with the medications they are taking. 15. Wear comfortable clothes. Many people think that when they have the flu, they should wear thick clothes or many layers of clothes to keep warm. Wearing clothes that are too thick will make it difficult for the patient to move, cause skin irritation, and hinder the body's ability to sweat. Seasonal flu is a common disease that rarely causes serious complications, but should not be taken lightly, especially in the elderly and people with underlying diseases. 70 to 85% of deaths and 50 to 70% of hospitalizations due to seasonal influenza occur in people aged 65 and over. WHO recommends annual influenza vaccination to reduce mortality by 70–80%, prevent complications, reduce the risk of illness and hospitalization by 60%. Vaccinated people who get influenza have milder symptoms and a shorter illness. Therefore, vaccination is an effective preventive measure.